Hello and welcome to The Balance. I'm your host, Andreana Jackson. I'm a realtor with over 10 years of experience in the Miami real estate market. My office is currently in Miami Beach with London Foster. And welcome to The Balance today. Today we are going to, our topic is wellness in action, bridging medicine, community, and personal balance. I am honored to have Dr. Michelle C. Powell with us today, Councilwoman Seat 3, Miami Gardens.
Yay!
Welcome.
We should be hearing some drums or something. Because you said it so beautifully.
Oh,
You said it so beautifully. Thank you.
well, welcome, Councilwoman, Dr. Powell.
Yeah.
Full disclosure, she's been a friend for many years, and so today's discussion is just going to flow like a natural conversation.
Yes, friends. Friends chat. Yeah,
Yes.
friend chat.
So I want to introduce you to the public. Can you tell us about yourself, your path?
Wow, that's so huge. I know. She's first family physician. I've been a family physician for over 30 years. I completed my medical training with Nova Southeastern, but to go even further back than that, I was born in Jamaica and lived in Brooklyn, New York for a very short period of time when I was a kid. Thank God we moved down here to South Florida to 62nd and 2nd Avenue. I was in Little Haiti, Edison area for a time, and then we moved to North Miami. And proud alumni of Archbishop Curley, and then I went to Florida International University for my undergrad as a medical technologist, and then left there. Worked for about 3 years, working with children with HIV when it was a new disease. I was kind of excited. I was hoping to go to medical school at that time, and I say I'm telling my story, but at that time when you had to go before a board to be recommended to become a physician. And when I went in with a GPA for number 5 in my class at high school, and went through FIU and the rigor of that program as a medical technologist, I was told, no, you don't qualify to be a doctor. And then my exit exam out of medical technology, class of 25 people, I failed twice.
Ooh.
And so it was proof and pudding. I couldn't get my recommendation letter from the board to be a doctor, and I failed the exit exam twice. So, okay, that's enough. I won't be a doctor. And so I got a job working with the new disease called HIV. And at that time, it was infecting children who were born from HIV mothers, and there was no treatment for it. And they were just starting to use AZT, that medication. And I thought, okay.
So this was in the late...
This was in 89.
89.
And I started that work with the Mailman Center. And believe it or not, I was going to the homes in Overtown to kids who were born with disease because they were dying when they were born. And I did early child development. So my background is education strongly. And by working with kids from birth to age 5 in the home, teacher, walk, talk, I had a different perspective. And I think that perspective influenced my career, because later, after 3 years, I did apply and go to medical school, was accepted at Nova. But what I learned in those 3 years, understanding where people come from, their life experiences, the environment that they live in, impacts, what shows up. And so it gave me an understanding of grace, how to give grace more. Because at that time was an egomaniac, and went through my own trials of being rejected into, and so having that experience for 3 years, I understood that
people don't know what they don't know.
You don't know what you don't know. And now I understood that a lot of kids, believe it or not, if they're not allowed to scrabble on walls and paper and things like that, it affects the development of the brain. And so sometimes we find minority children not being as advanced in math, but those early childhood years impact their growth. So I learned that because I went into a home and brought markers for the child to scrabble. And Mom said, please don't give them markers. My furniture is rented. I don't want anything to make me have to pay for this.
Oh, Lord.
Yes. So the child was withheld
free to do what they need.
To learn to use markers and cut scissors and papers because that environment was limited because the income was so low she had to rent her furniture.
Ooh,
Perspective and grace.
right.
Yeah.
So tell me this. What made you decide to go into your path as being a councilwoman, to get involved?
Wow. So I worked with as a family physician with Nova Southeastern for about 4 years, and I decided to branch out into my own medical practice. And I was running my own practice as a family physician. And along the way, I've always been an educated teacher, teaching health and wellness. And every year I would, during breast cancer awareness, give a talk on breast cancer and everything. And believe it or not, at height of COVID-21, I felt a lump in my breast, and I thought, it's just a lump, ignored it in September, had my mammogram every year, everything's fine, and it stayed there until February. And my fiance, Darvin, says, what are you doing about this? Are we going to do anything? And I said, it's just and he gave me that look like, let's do this.
Is it part of denial?
Of course. Yeah. And having worked with people who've had breast cancer, I already knew. And so I was diagnosed with breast cancer. And one of the things going through the journey of healing from breast cancer, any cancer, especially getting chemo, my body was completely changed. I was get chemo and I would be stuck in a chair for a week. And then doing chemo, which was 8 hours every 3 weeks. You can't do anything else but think. And it's also a time to hear the voice of God. I was moving and ripping and running as a doctor, entrepreneur. I was a hospitalist, had 2 kids. I had 2 stepkids. I had 4 boys in my house. It just was going. And I would say the blessing in getting breast cancer gave me time to think. And coming from that and my conversations with God, he said, you've been serving people in your practice, but I need you to go larger and wider. I need you to serve your community.
Oh, wow.
And that's how I made a commitment to serve the community. So my mission is to bring health to the gardens, which is my community now, Miami Gardens.
So Miami Gardens is the 3rd largest city in Dade County.
It is.
Right.
Yeah,
Miami-Dade County.
We have over 110,000 residents. And my residence district alone, seat 3, has over 20,000.
Wow. It's huge.
Yeah.
It's huge. So one of the things I noticed when reading your biography, before you even were elected in Miami Gardens, you had started in 2017, you had started Wellness Wednesdays.
Yes. My goal has always been as an educator, because I found out that in dealing with patients, when you're young and a go-getter and egotistical and you think you know everything, I got my degree, I've got my 4 degrees, I'm a bachelor's in medical technology, I have my master's in public health, have a degree in a fellowship in health policy, everything.
Right.
So my conversation with my patients is, I know what you need,
Mm-hmm.
And then I think the past 10 years ago, I realized, no, I don't. I need to know and understand what the patient wants. And so with understanding the needs of patients and listening more, I realized there was a lot of misunderstanding about medicine. And so I decided to start going out and speaking in North Miami Beach and anywhere I could and they call me the doctor that breaks it down, make it plain.
Well, here's observation. Is it more or less in the African-American community where the misinformation is? Or is there more of a, not misinformation, but far as, I would say, a distrust?
It's multifactorial. A great deal of the mistrust has been surrounding medicine, as African descent people historically has been used as the guinea pig for science and medicine without clear understanding and communication about what's being done. As we can go back to the historical Tuskegee experiment, where you had men infected with syphilis and wasn't even given treatment until many of them died and had already passed it on to family members. John Hopkins, tons and tons of historical data, not to mention even today we don't have enough minorities, not only African descent, but Hispanics, in the research to gather the correct data, because medicine affects as many ethnic communities differently. And until you're in the study, the effects of medicines cannot really be truly understood.
Correct.
And so you have those experiments, but then also the disparity where when you walk in, the majority of doctors didn't look like the patient. And those doctors weren't trained with patients who didn't look like them, and communication and the understanding that's needed. So I give you an example. In my residency program, I was one of 2 Black people in the residency program, and there were 20 of us. Okay. And one of the places I trained was predominantly Caucasians who were there. And when the Black children would come in and they had infections in their hair, they would say, that's because your hair's dirty and those things in your hair is making it infected. And they're talking about their braids and their locks.
Oh, okay.
Okay. And they would call, I think they have these braids when there were plaits. And didn't understand the difference between plaits and locks and weaves, and so when they communicate, they look down. And I heard these conversations myself, and because of that, you get mistrust. If I'm going to call your hair dirty and nasty, and what you're doing to maintain it inappropriate, it limits trust.
Right, because you don't understand what you're talking about. You don't understand the patient.
So access, understanding the ethnicity of the group, and not only the sensitivity. There's lots of study. Blacks don't feel as much pain, but they're pain seekers.
Yeah, I think that was
a lot of study. Yeah, lots of studies. So with that, yes, we find that African descent people are top of diabetes, top of hypertension, top of chronic diseases that could have been prevented and have had a better course. The top in not receiving treatment and dying from breast cancer and prostate cancer and colon cancer because of disparity of access, understanding, and trust.
And so how are you mending that?
So I decided to teach in a way from my historical background of coming from the Caribbean and understanding there's nothing wrong with Cersei tea and bush tea and having mint tea and ginger tea to help a problem.
I love my hibiscus tea.
And hibiscus tea, and also bridging that, knowing that I was raised here in South Florida and have been a United States citizen for over 45 years, and understanding that culture, I was and the teacher able to communicate more effectively. So I started Healthy You to teach health in a way that people can understand, and not at the level and not down, but just in a language that people can relate to, and using examples. I give an example about diabetes. I used the other day. I said, think of diabetes as a bank account that you've bankrupt. You had all this insulin in the bank,
right,
to help you absorb carbohydrates and starches. But you're bankrupt now. You've done withdraw all the insulin, so now you need insulin to be imported. You got to get a loan, and your loan is that insulin medicine that you get and have to take to be able to absorb your carbs.
Yes. So you do, for Wellness Wednesdays, we're talking about diabetes.
All chronic illness, hypertension, even how to speak to your physician when you go to your doctor. What is the different tests that they say? What's an MRI, CT? What's a scan? What's the difference between your bone density? What are the important lab tests for prevention? CBC, CMP, lipids, hemoglobin A1C, and I explained what each one. Today I did prostate cancer because it's Prostate Cancer Awareness Month. Things like that. And I transformed that as a commissioner into Healthy You. And so every first Wednesday at 1, I do a Healthy You on a topic, and I have guests that come in to talk about whatever issues. Like this month, we're doing prostate cancer and suicide prevention.
So I was going to ask you about mental health.
Yeah.
So how is suicide affected in the Black community?
Wow, we're leading, and was very prevalent, and we're seeing it, believe it or not, in our older population and in our very young population. We have the highest incident at this time of young people under the age of 18 committing suicide than ever.
What's leading to?
Again,
social media.
It has to do with a lot of pressure, a lot of misunderstanding. We went through COVID where socialization and communication and engagement and problem solving stopped. So the norms, and then, like you said, social media, what's real, what's not real. Everyone has to be beautiful and successful, and that's not the reality. And then the peer pressure that exists. And so a lesson has to be taught on how to utilize social media health in a healthy way. Yeah, and parents, we can't be blind to the signs of suicidal thoughts and ideation and depression.
Well, you have a lot of parents who are working.
They're working, and life has shifted in such a way where some parents are working at home but are still disconnected from their family.
Correct.
Yeah.
Correct.
Yeah, so I do work with mental health. I did a mental health symposium back in February, which was really effective. No, May of this year, and we brought out 6 mental health specialists to work with the Miami Gardens community on mental health and wellness. Because my philosophy, the mind precedes the body every day, every day, and every time.
Right, right.
So it's about thinking. So is the body.
You have to put the positivity out there. I also noticed for Breast Cancer Awareness Month, you're having a comedy show.
Laugh It Off.
Tell us about that.
I chose, as a cancer survivor now going on 4 years, I realized that, first of all, cancer is a disease that can be cured. And I think we have to establish that. Many cancers can be cured because it's 2025 and we're no longer in a place where we don't have the technology. So for those who will be watching this, if you even think that you may have it, we have genetic testing just by swab. We have blood tests to check PSA levels. Get tested. If even you have a family member who might have had it, we can do your BRCA gene testing. So during that process, I realized not entertaining a negative thought and not entertaining negative people, working with the mind, but also laughing, knowing that you may be going through something, but finding humor and looking at things to make laughter is healing. Yes. You know, it's really healing. So for me, I like watching my TikTok. I'm looking at babies and dogs and people acting silly and the little baby memes now that are coming out. Yes. I love them. I love them.
Yes. Laughter is very important.
So we're doing Laugh It Off on October 25th. At Florida Memorial University for breast cancer awareness and donations for breast cancer. We're partnering with the Dolphins for the Sylvester Challenge for breast cancer.
I know, so that's good stuff. A lot of different communities are trying to implement, I see, different wellness activities, and I see you're putting it out there. But these are things you've been doing.
Yep, we've always been.
So do you ever give speeches like talks on women with menopause?
Oh, most definitely. I just completed one. Funny you say, hot again. It's called hot again. You know, are you perimenopausal, menopausal, or postmenopausal? And it's so crazy. Yes, I've been doing talks on menopause because we have a shifting baby boomer and a whole population that no one ever talked about menopause.
Are you talking about the Gen Xers?
Oh, my gosh. They never did. You know, they just went through it and they just looked elegant and just fanned a little bit. And we're like, what's going on? I can't remember anything. I'm crying like crazy. My weight is going over the hill. And we're saying, okay, how are we going to fix this?
Is it because these just aren't conversations nice ladies normally have in polite society?
In polite society. And our generation is not polite anymore. We will say it and talk about it, and I'd like to say nicely, in a nice way. But we are asking questions. We need to ask questions. Even the political scenario that we are currently engaged in this nation, we need to ask the question. We need to ask a question, look for the answers, and if we don't like them, we need to challenge them.
Yes. Never stay complacent. Always ask questions. Yeah. I just thought the way things go with far as with aging and the menopause, no one talks about it, and all of a sudden one day it's there.
One day I started at 47. I was fairly early for most people. Most people usually about after 50. I started at 47, hot all the time, and hot, cold. Oh, it goes from hot to cold, right? You know,
right.
You're freezing, then you're hot, and then you want to take everything off, then you put everything on. And then going through cancer, the medication given, I'm taking letrozole, it forces you into menopause and shuts down. And there are a lot of side effects associated. And I have to come back and just talk about menopause, but
Right.
it's pretty cool. But there's some wonderful perks to it. Of course, is number of children. I always said there's no forgiveness after 50, which means everything you do affects you.
Mm-hmm.
But it's also no explanations and no excuses. You know what you know. You need to do what you know, and you don't explain it or make excuses about it.
Right. It's a different experience. I'm not quite to my to 50 yet.
Yeah.
But the hot flashes have definitely started.
Perry, you're circling Pluto, huh?
Yeah.
You're circling menopause.
I'm not there yet, but one of the things going as I march towards 50 was to get my body right.
Yeah.
So I wanted you to talk about, and I've seen you on your TikToks.
Yeah.
Talk about exercise, and especially with Black women.
Yes. I'm glad you asked that question because we've said, Doctor, I don't know how you doing all this stuff, and your show is called Balance. And the truth is there is no balance, but there is priority, and I think we must start as Black women in particular, and even as women, to place a priority on our health and wellness. Know whatever you're trying to do.
Mm-hmm.
So, especially as Black women, we're all taught outward first before inward, not understanding that not going to the doctor yourself, but taking someone else to the doctor in the long run will affect you. Giving someone else their medication and not taking yours somehow will impact the family dynamics.
I know some Black women, and I'm saying it just because I am a Black woman and I have went through this, our hair.
Yes.
So because of our hair, we won't
sweat. I'm not sweating. Look, it took me $160 to get this hairstyle. Do you think I'm going to sweat this baby out? No. And I said to again, so what I do for myself, because as you know, I have a lot of engagements and things I'm working, you got to learn to work arounds. Because, so the priority is my health. Yes, I spent money on my hair. What can I do to keep my health a priority? If you have a significant amount of weight that you have to lose, which will require a daily workout, you need to adjust your hairstyle and not your hairstyle adjust for your health. Amen. And I think we're putting our hair above our health. So let's wrap that baby. This is what I do. I wrap it up, put my tie head on, do my workout, come back, blow it out, and sometimes I wear it curly and then I wash it to get my curls back nice the way I'd like them. So we must start adjusting our life for our health and not adjusting our health for our life.
Yes.
So that's where balance comes in. So if it means 5 o'clock is going to have to be your wake up time because the rest of your day is gone, I get the kids together, I got to go to work. By the time I pick them up, I go visit my mother, and it's gone. Right. So that means maybe it's in the beginning. But if you do have the free at the end, then let me do my workout then, because if I get sick, the price of illness is so high and the cost is so high.
It is.
You won't be present for the family you're trying to care for. You're going to take resources out of the home to take the medicine, pay those bills, do the test. Yeah. It's costly to be ill. Yeah. So let's do the preventive thing now. Say, I'm not taking time away from my family to be healthy. I'm giving to my family by being healthy.
You need a healthy body. In the past, let's say 7, 8 months, I've gone to over 60 Pilates classes.
Yay! And how do you feel?
I feel fantastic.
Nice.
Because I thought my body was going on a decline in some way.
You can feel like that, yeah.
I was having a problem walking downstairs, and that scared me. I was like, oh, no. Yeah. Now I'm running downstairs.
Nice.
My body's much stronger. It's toned.
And I want to give a message to everyone that I'm not going to lie. It's not going to feel good in the beginning. It's just not. You haven't been doing it for a long period of time. You haven't been working out or meditating or stretching or exercising or Pilates. Look, the first 2 weeks, your body's going to say, what? Are you trying? What are you doing to me? And you're going to have to say, I don't care. I'm going to be healthy. You got to stay focused. I'm going to be healthy. Yeah.
I was going through some things earlier in the year, and I was like, well, either you're going to, succumb to it or you're going to work through it. And I chose to work through it.
And I'm proud of you. Keep doing it. Keep doing it.
Here.
And even if for a couple of weeks ago, I injured my knee and my shoulder. I'm doing a boxing class. And even if you stop, don't quit. Even if you stop, don't quit. Just start again.
Have a walking routine.
Nice.
Grab some neighbors. We do it.
Nice. So you got a team. So good. That's community where we pull other people in. And that's how we expand health in our community. Start touching somebody and bringing them in.
I'm going to have you come back because there's just so much to you. But I wanted you to cover our dear Queen's, Serena Williams is doing the weight loss drugs.
Yes.
Can you comment on that a little bit?
I believe in taking what you need, but make sure that you are taking what you need. So, for instance, we have a Weight Loss for Life program in my office, and as a physician, I do an assessment. Is that what you need?
Okay.
Okay. So, the first thing you want to do is, in my program, you have to create discipline. So, you can take a drug like what she's giving, but if you don't have the discipline to maintain it, you will be forever on that drug. So you have to have the foundation of the lifestyle, the eating right, the exercising, or else you'll look like melted wax. The weight will be gone, but you'll look like melted wax, and you will fall back into bad habits. So foundation is essential, and making sure you do need the drug, because many people can lose the weight without it. Correct. And some people do need the medications. So it's not that there's anything wrong with the meds, but make sure it's what you need, and not just because you want a quick fix to get to a place that you can't maintain.
That's important.
Yeah.
Because all the money you've put into it, it'll just come back.
I've seen people have some beautiful surgery, tummy tucks, breast lifts, and within 3 years after a gastric surgery have gained at least half the weight back because they didn't develop the foundation. And what's the foundation? The mind before the body. I have to commit to a life change and not just a momentary fix. Yeah.
What do you want to leave us with today?
Best thing that I can leave with you is, as we talked about, obstacles are just something in your way, but don't give it the power to take from you the goals and desires and dreams of your heart placed by God.
That's powerful. Yeah. Well, thank you, Dr. Powell. Let's see. So you're coming up on your 1-year anniversary.
Oh, yes, as councilwoman, yes. It was the 20th of August, 1 year, and it's been a learning curve that's been, I love new things. I love learning new things, and that's one of the things I've learned, and I love that I'm reaching the community and fulfilling my goals, which is to bring a healthy gardens to Miami Gardens.
Well, it's a beautiful city, and they're very lucky to have you.
Thank you.
I'm very honored that you were able to stop by with us today.
Thank you for having
share some
me.
of your wisdom.
I love the show. I love that you're doing the balance. I think it's so imperative that we have these conversations. So thank you for having me and giving me the opportunity to share.
Well, thank you. Thank you. Will you come back?
Most definitely. We have to talk about menopause menopause. We're definitely going to talk about menopause. And menopause, by the way.
Oh.
There is a menopause, but
really?
That's another conversation.
Oh, my.
For the Healthy You Doc.
Okay. So, well, you'll come back in the spring and discuss that one, right?
For sure.
That will be amazing.
I'd love to.
Thank you.
Well, and I'll have to tell everybody where you can reach me if you want to hear any more.
Please.
Yes, you can reach me at Dr. MC Powell at Instagram, Facebook, and for my council activity, you can find me at Councilwoman Dr. Michelle Powell from Miami Gardens.
Amazing. Again, Miami Gardens is very lucky to have you.
Thank you.
And I'm lucky you stopped by today. I wanted to thank our community partners here, Community News, the Miller Brothers. I'd like to thank my
awesome group.
My great producer, Emily, for helping make the show possible. And in 2 weeks, I have another show coming up for us. We'll be exploring the health of the Miami real estate market, and we'll hear from an investor and a mortgage professional. So thank you.
Awesome. Thank you again.
You're welcome. Well, thank you.
Good luck.
Yes.
For more.
Bye.